Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Jay Parikh, a professor of radiology and the wellness lead in the Division of Diagnostic Imaging at the University of Texas MD Anderson Cancer Center. We are talking about the importance of mentoring during a radiologist's career. Thank you, Dr. Parikh, for joining me today.
Oh, thank you so much, Miss Allen, for having me. It's a real honor.
First question is, what is the importance of mentoring for a radiologist during their career?
So mentorship is the natural part of the professional and personal growth of mentees. And so mentorship is part of the fabric of the growth of all of our mentees. Ideally, the mentor should have a long-term relationship with a responsibility to provide the support, knowledge, and environment that empowers development of the mentee.
Is mentoring just for young radiologists, or can more experienced radiologists benefit from it too?
Mentorship has value throughout the life of the radiologist. For example, when we're in school or when we're in university, there are typically people that we look up to that help provide us guidance during our growth. That continues during the career of a radiologist. In academics, for example, when transitions from junior radiologist to mid-career radiologist to a senior radiologist, there are different needs of every phase of life during the academic growth of that radiologist. This applies as well in the non-academic environment. Irrespective of what stage of career you're at, there's always opportunities for people to learn and grow with appropriate mentors. In the senior radiologist space, for example, senior radiologists are often interested in different aspects of growth, whether that be leadership, administration, volunteering, philanthropy, contributing to the greater good of society in some positive way. And reaching out to mentors can really help facilitate that development at that stage of career.
What types of support does a mentor provide?
So the mentor typically can use different styles depending on the content and style of relationship they have with the mentee. Often they provide advice, they can provide guidance, they can provide support, they can provide impetus for growth, they can provide enthusiasm, courage, they can provide an overall framework and environment that the individual may not have known before that can help the mentee grow.
If a radiologist is looking for a mentor, where would you recommend that they begin their search?
So early on in the career, it is very challenging sometimes for mentees to find mentors. In academic departments, there are sometimes formal structures in place. For example, external committees may use a pairing system where a mentee can be paired with a faculty member that's more senior at the very outset of growth. In some settings, however, the formal pairings aren't there and they use an informal structure where a list of mentors is circulated potentially to mentees, and then the mentees can decide amongst that list of mentors who they may feel most comfortable with. That may be based, for example, on a clinical rotation where they interact with a potential mentor and start to feel comfortable with that individual. It should not be forgotten that early in a career that sometimes some of the best mentors are peers. So for example, in the academic environment, when you start out and you're junior faculty, using other potential peers to bounce ideas off and form research collaborations is an excellent way to develop long-term relationships. In some institutions, there are also opportunities to potentially find mentors outside of the department in other departments. For example, underrepresented minorities sometimes feel more comfortable working with mentors of similar backgrounds because they can relate and bounce ideas off of each other and feel more comfortable doing that. So that's another opportunity and avenue for potential mentors. Also, some institutions now are using distance mentoring, where a mentee can couple, sometimes informally or formally, with mentors outside of the institution. That especially applies to niches where there may be limited availability of mentors in smaller institutions or departments. For example, individuals wanting to pursue leadership roles in specific areas or research in specific areas or administration that may not have mentors available immediately in the institution. Also, I can't help but mention that sometimes, unfortunately, the reality is some of the work and effort in terms of finding a mentor really rests upon the mentee. Meeting other potential mentors in local groups, in local societies, and even national societies is a great way to potentially network and potentially find future mentors. One outstanding example, for example, is the RSNA, where attending local meetings and national meetings helps the individual find potential mentors there as well.
Great. Thank you so much for your time today, Dr. Parikh.
Well, thank you so much for having me. And for all the mentors out there, thank you for taking the time to invest in the future of our specialty. It's because people actually invested in us that many of us became who we are, and paying it forward will pay dividends for our specialty. So thank you for your work.
For more radiology news, visit rsna.org/news.